everyone. My name is Caitlin Winkler, and I run the intensive outpatient program for substance abuse at Our Lady of Bellefonte Hospital. And I'm here today to talk to you a little bit about the benefits of having a drug-free workplace. First is the prevalence. Of the 20.4 million adults classified with substance abuse dependence or abuse, 12.3 million, or 60.4%, were employed full-time. It is out of this 60.4% that those working in the mining and construction industries suffer the most from substance abuse. Though every field has issues with substance abuse, those working in these fields are at a higher risk. You guys can see that the consequences of drug use in the workplace can be quite significant or even fatal. So what is the cost to the employer? According to the Office of National Drug Control Policy, $120 billion is lost in productivity, mainly due to labor participation costs, participation in drug abuse incarceration, and premature death. And this is not counting litigation fees that the employer can expect if other employees are hurt due to substance-induced accidents. So we can all see why the drug-free workplace program is beneficial to you as the employer. Now we will begin to talk a little bit more in depth about what addiction is. Now, this is a very complicated disorder, so we have tried to keep it short and simple for you today. Addiction is a disease of the brain that is both chronic and progressive. It impacts us emotionally, spiritually, and physically. It is classified mainly by two medical criteria. The first one is tolerance. This is the need to ingest more of the substance for the same high. The second criteria is withdrawal. When ingesting of the substance stops, those suffering from addiction can become very ill, both psychologically and physically. Unfortunately, addiction has been misunderstood for decades. This has led to many more unnecessary drug-related deaths. The truth of the matter is, anyone can suffer from addiction. It is a misnomer that those suffering from addiction are homeless, weak, or in lower-paying jobs. There is a genetic predisposition to addiction. If your mother or your father abused alcohol or drugs, you are actually 8 times more likely to abuse these substances in adulthood. Addiction is neither racist, sexist, or bias of any kind. One of the most popular questions I am asked today is, why do people abuse drugs and alcohol? And this is a very good question. There are many reasons why people feel the pressure to abuse drugs and alcohol. One of the most popular reasons is due to other pre-existing mental health issues, including, but not limited to, depression, anxiety, and post-traumatic stress disorder, which we see a lot of the time in our vets. Another reason is social pressure. Those we surround ourselves with may be normalizing the substance abuse. Familial issues can also be a reason. Problems at home can result in the need to escape or find external coping measures. And finally, financial issues. This is an enormous trigger. Alcohol and drugs give us a way to feel we have control, even when we do not. In looking at the most popular drugs abused today, it is also important to look at where these addictions are taking place. The map to the left shows the current drug overdose death rate. The darker the state, the higher the death rate. As you can see, the area we live in leads the nation in drug-related death today. And of course, this is right here. The plus side to this epidemic is the amount of new support and community resources that are now available to employees as well as you, the employers. In Central Appalachia, the most popular drugs being abused today include alcohol, marijuana, opiates, including pain relievers and heroin, benzodiazepine, which can include Xanax, Klonopin, or Ativan, and methamphetamine. Again, with the representation of the state of Ohio, The darker the counties, the higher the abuse. So again, our area continues to lead. There are over 150 new synthetic drugs introduced to the market annually. This makes it very difficult for law enforcement and employers to keep up. Synthetic drugs seem to become more fatal each year. Many batches coming out of Cincinnati, Akron, and Detroit have been cut with elements such as fentanyl. Fentanyl is 500 times more potent than heroin. Some of the heroin in this area is even being cut with elephant tranquilizer, which obviously was never meant for human consumption. There's also Flocka. This is the cousin of bath salts. Though bath salts have been banned, the active ingredient alpha PVP has not. This can be screened for, but it is very expensive to do so. We apologize about the image to the left. We know it's disturbing. Crocodile. This is a combination of opiates and other chemicals such as iodine and paint thinner. This drug originated in Eastern Europe and is now very close to home. The disturbing picture to the left is the consequence of using this drug. There are many forms of drug paraphernalia out today. Those abusing drugs are very resourceful and can change how they ingest substances very quickly. Here we have included the most popular forms of paraphernalia seen and reported today. Paraphernalia can include pipes or pinch hitters, empty bottles of alcohol. Tutors can include cut-off straws or broken pens, uncapped needles, spoons with burn marks at the bottom, saline solution, Nasonex, blunt wrappers, and empty cellophane wrappers with pill residue on them. There are hundreds of symptoms to look for when discussing substance abuse and withdrawal. We have chosen to present the more obvious signs to you today. Symptoms of intoxication can include slurred or stuttered speech, eyes dilated or constricted, as you can see on the picture to your left, the smell of alcohol or marijuana, pill residue in the nostrils, obvious memory loss, inappropriate sweating, indications of IV use, also known as track marks, and these can be found on arms, neck, hands, in between toes and fingers, and even in the gums and eye ducts, all of which can become inflamed from infection. Being in a state of withdrawal is just as dangerous on the job as being intoxicated. Physical symptoms of withdrawal are much like flu symptoms. These can include inappropriate sweating, cold chills, constant yawning or scratching, dark bags under the eyes, pain in the bones, having a tough time getting around, diarrhea, vomiting, withdrawing from certain chemicals such as benzodiazepine or alcohol can be fatal. You may think it is impossible to notice psychological signs of alcohol and drug abuse, but it can result in a complete change of your employee's personality. Psychological symptoms of withdrawal can include anxiety, irritability, depressive symptoms, memory loss, poor concentration, insomnia, or even social isolation. Employers taking advantage of the drug-free workplace program have multiple concerns, and understandably so. Concerns include, but are not limited to, workplace injury to oneself, workplace injury to another, such as a coworker, excessive calling off, excessive healthcare spending due to accidents, and loss of funding due to low workforce. Now we have approached a very hot topic in treatment and legislation today. What is the solution? First, there are two different schools of thought, and first is policing the issue. Establishing and maintaining consequences for substance abuse without treatment, drug screening without follow-up, and focusing on efforts on firing or arrest as opposed to support and treatment. Though we advocate for treatment over policing, there are times when we as supervisors must take action. The second school of thought focuses more on treatment. This includes making sure employees have adequate access to community resources, making sure employees are told on a regular basis that substance abuse is responded to with support and treatment, and encouraging employees to come forward, emphasizing the incentive of protection from firing upon completion of treatment. As most of us supervisors know, policing the issue only gets you so far. Employees are much less likely to come forward, and thus job site accidents and call-offs increase. What many people don't know is that it is not only more efficient to treat substance abuse as opposed to policing it, but it is also cheaper for you, the employer. As employers, it is vital to understand the cost-benefit analysis in every budgetary decision we make. Helping your employee to get the treatment they need is much cheaper when compared to the number of paid miss days, the liability payouts of workplace injury, not to mention the health coverage for those struggling with addiction in and out of hospitals each year. The Substance Abuse Mental Health Services Association explains that the most successful drug-free workplace plans are also based on support but fueled with the need for evidence. So make sure if you have any concerns with an employee, you get those urine drug screens immediately. Also, having access to referral guides for treatment is needed, along with employer support. This does not mean to stop urine drug screens or looking for evidence of intoxication or withdrawal. The change in plan is how the employer reacts, with empathy, support, and information on treatment. Remember the acronym OAT: Observe, Act, Treat. By helping your employees treat the issue, they become more comfortable in opening up to you. They are more likely to see you as an ally, not as the enemy. We as employers must continue to be vigilant in demanding a drug-free workplace. So in conclusion, changing tactics from policing the issue to treating it may be awkward at first, but it will save you many financial headaches in the future. So remember, OAT: observe signs of use, intoxication, and withdrawal. Act: administer drug screens immediately. And treat: upon confirming drug abuse, assist your employee to get the help they need. Now that ends our drug-free workplace presentation today, and I'd like to thank you guys so much for having me. Thank you.